Alia, very good morning to you. Thanks very much for joining us.
Morning.
Thank you very much. I mean, this increase is something like a 21% jump since 2019. And of course, most of the NHS trusts in England are suffering from this problem. What do you think's going on?
Well, unfortunately, we've seen services in the NHS sort of devalued for years now. So unsurprisingly, people who try and access the NHS are struggling to get a service that they probably feel is appropriate. We see lots of difficulties when people come to A&E, for example, and they've been struggling to get care outside of emergency support in the community, which is where they should be cared for quite a lot of the time. But they don't get that support. They don't get the support that they need from their...
No, sure, but that's not the issue, is it? The issue here is the violent physical assaults that are happening, and so no matter how bad the NHS is, and no matter how much you're waiting, I mean, there's no excuse for a physical assault, surely, is there?
Of course, there's no excuse, but unfortunately, it is something that we've seen more and more of in mental health services. For example, when I worked there, say 15 years ago, it was different. But even then, we had lack of staffing that meant that sort of staff were in situations that they shouldn't be, with people who weren't well, for example, and weren't able to control themselves in the way that they would if we had different support services available to them.
Yes,
Now
but
it's
the
far
figures that
worse.
I'm looking at here, it says the investigation has revealed 142% increase in reports to the police of violent assaults on hospital staff since 2019. So there's clearly something else going on here. There's more violence going on. I just wonder what we can sort of put that down to.
Well, I mean, this is what I'm saying. I think there probably is, violence that we are seeing more and more. And I'm saying, you've said 2019, we've seen these huge increases. We've also seen since 2019 huge increases in the need for services. And since 2009, we haven't had any increase in staffing. So if you've
There's
got...
more doctors in the NHS now than there were, though, 10 years ago.
But I don't know if that's true.
It is true.
In terms of in terms of when we see the vacancies. So we've got more than 100,000 vacancies across.
Oh, there's a lot of vacancies. Yeah, that's true. But there are 45,000 more doctors now than there were 10 years ago because they have been recruiting doctors. But like I say, the issue for me seems to be that there are people now who think it's acceptable to be violent in a hospital. I mean, my son was in a hospital not that long ago, an A&E ward, and he said it was a pretty awful situation. There was sort of carnage. There was people lying on the floor. There were people waiting hours and hours to be seen and all of that. And I get all that, and I understand that that's a problem. But there wouldn't have been the level of violence years ago that there seems to be now. And I'm wondering if there's some other reason for it that we can get to.
Yeah, I mean, I'm agreeing with you. It is a lot worse now. And I'm suggesting that at a time when we already had fewer staff than we needed, it was already bad. And now we have so many more people accessing the NHS, fewer beds. As you said, A&E is like carnage all the time.
Yeah.
We don't have people in beds. We have people throwing chairs because they can't express themselves in other ways. And that does affect staff, throwing other things.
Yeah, but that shouldn't be allowed. I mean, if I was in a position to do anything about this, if anybody did anything like that, I would just ban them from ever coming anywhere near a hospital, because surely the thing that we must safeguard is the health of the people who work in the NHS, who do not deserve to be mistreated. I might get very frustrated waiting in an A&E department, but I would never in a million years think of being violent to someone.
Yeah, and I agree. It's not a good situation at all for staff. I have experienced violence, and it has led me to leaving the service that I was working in. And I don't think I'm the only one. I think lots of staff leave because it's just not a place that's nice to work. However, I would say more staff, more resources would really, really help people who are on the wards and who are struggling to provide support for their fellow staff and for the patients. If we had more staffing, it would mean that we could deal with things better and people would be less annoyed and angry about the service that they're receiving.
Yeah. I mean, it may well be as well that people are so frustrated because they, as you say, haven't been able to get to see a GP, or they haven't been able to get to see, a dentist, or they've now going to be pulling their own teeth out and this kind of thing. The whole system is kind of collapsing down around its ears. But there's more money being poured into it every single year.
I think if you look at the figures, we've had a huge drain in funding in the NHS in terms of what we need to be seeing in the NHS.
Yeah, but isn't that down to the NHS? Because the NHS decide what to do with all the money that they get, and they allocate some money to hospitals and to clinical care, and they allocate some other money to managerial roles or roles which are not really frontline services.
I think actually the way that the NHS is funded is very much decided higher up than people who work in the NHS. And that there has been changes in policy that has meant that the NHS has been opened up to various types of privatisation that hasn't been very good.
Yeah, well, people are going to privatisation because they can't get the services on the NHS. But listen, we've got to leave it there. Alia, thank you very much indeed. Alia Butt there, campaigner for keeping our NHS a public